Hello. This is the third presentation on iron deficiency. Today we are going to talk about iron deficiency anemia. What is iron deficiency anemia? Iron deficiency anemia is the most common type of anemia occurring when the body lacks sufficient iron to produce hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, the body cannot make enough healthy red blood cells, leading to fatigue, weakness, and other symptoms. What are the causes of iron deficiency anemia? Iron deficiency anemia can result from several factors, including inadequate dietary intake, not consuming enough iron rich foods, such as red meat, leafy greens, and beans. Second, blood loss. Chronic blood loss from heavy menstrual periods, ulcers, gastrointestinal bleeding, or surgery. Third, increased iron needs. Pregnancy, breastfeeding, rapid growth in children and adolescents. Fourth, poor iron absorption. That happens in conditions like celiac disease, Crohn's disease, or gastric bypass surgery that can reduce iron absorption. What are the symptoms of iron deficiency anemia? The symptoms may develop gradually and include fatigue and weakness, pale skin and brittle nails, shortness of breath, dizziness or lightheadedness, headaches, cold hands and feet, unusual cravings for non food items, otherwise known as pica, poor concentration. Next, how to make the diagnosis. Doctor may diagnose iron deficiency anemia through blood tests. The first one they order complete blood count, otherwise called CBC. It checks hemoglobin and red blood cell levels. Second, serum ferritin test. It measures stored iron. Low level indicates deficiency. The other test, iron and TIBC, total iron binding capacity. It assesses iron levels in the blood. Some patients may need additional tests such as endoscopy or colonoscopy if internal bleeding is suspected. Finally, how to treat and prevent. Number one, dietary changes. Take iron rich foods. What are they? Red meat, poultry, fish, lentils, spinach, and fortified cereals. Second, vitamin C rich foods. It often taken along with iron rich foods. It enhances iron absorption. What are the vitamin C rich foods? Citrus fruits, tomatoes, and bell peppers. And avoid iron blockers, especially after the meals, like tea, coffee, and calcium rich foods can inhibit absorption. If you have to take after an hour of meal. Second, iron supplements. Oral iron supplements are commonly prescribed, oftentimes ferrous sulfate and ferrous gluconate. Ferrous sulfate is preferred because of the cost. Otherwise, all of them are equally effective and side effect profile are comparable. Take with vitamin C, such as orange juice, for better absorption. The side effects of iron supplements may include constipation, nausea, stool may appear dark. And third, along with dietary changes and iron supplements, treat the underlying cause. For example, if the patient has heavy menstrual bleeding, needs to be treated with hormonal treatments. Treat the underlying gastrointestinal conditions such as ulcers, celiac disease, and Crohn's disease. In severe cases, intravenous iron therapy may be needed if oral supplements are ineffective. Blood transfusions are needed in extreme cases. How to prevent iron deficiency anemia? Eat a balanced diet rich in iron. Screen for anemia in high risk patient or if you are a high risk individual. What are the high risk individuals? Pregnant women, frequent blood donors, those who are on strict vegetarian diet or vegans, and also in children. Address chronic blood loss early. When to see a doctor? Consult a healthcare provider if experiencing persistent fatigue, unexplained weakness, or signs of anemia. Early diagnosis and treatment can prevent complications like heart problems and development delays in children. One important point, we have made a video on how the iron affects brain, especially in children. Iron deficiency anemia, it is end of the spectrum. When the iron deficiency anemia happens, the iron deficiency in brain has already happened. That has long-term consequences. So it's better to screen in children so that you can avoid development delays. Please see that video on iron deficiency and brain. In conclusion, iron deficiency anemia is a common but treatable condition. Proper diet, supplements, and addressing underlying causes can restore iron levels and improve overall health. This concludes video on iron deficiency anemia. Please share this video with others. Thanks for watching. We'll see you in next video. Thanks again.